What is a minor exercise injury?
A minor exercise injury typically includes strains, sprains, minor bruises, or small cuts, anything that causes discomfort without serious damage. These injuries may result in swelling, soreness, or limited movement, but do not involve broken bones, deep wounds, or significant joint instability. Recognizing a minor injury is crucial so you can confidently take the right steps to start recovery quickly and safely.
What should you do first after a minor injury?
The most important thing is to stop exercising immediately. Continuing activity may make the injury worse. Take a moment to assess how you feel. If you notice swelling, pain, or loss of movement, rest the injured area right away. Acting quickly to pause activity can prevent small issues from becoming bigger problems.
Should you use ice or heat?
For most minor injuries, apply ice as soon as possible. Ice helps reduce swelling and numbs pain. Wrap ice or a cold pack in a thin cloth and apply it to the area for 15 to 20 minutes. Repeat every hour as needed for the first day. Avoid using heat right away, as it may make swelling worse.
Is compression and elevation important?
Yes, both are helpful for many minor injuries. Use an elastic bandage or wrap to provide gentle compression. This can limit swelling, but be careful not to wrap it too tightly. Elevate the injured area above heart level when possible, which also helps reduce swelling and discomfort.
When should you seek medical attention?
Most minor injuries can be managed at home, but seek medical care if you notice severe pain, inability to move the joint, numbness, deep cuts, or if swelling and pain do not improve after a few days. When in doubt, it's always better to consult a healthcare professional for advice.